And here's a shocking statistic that I've repeated a few times during the show. Brain health issues directly impact more than 8 in 10 Americans. So today, we're going to figure out what's going on. Our next guest says one hidden influence is how hormones shape our brain and behavior. Joining us now is functional medicine expert, Dr. Cathleen Gerenger. Dr. Cathleen, it's always so great to see you.
It's great to see you, Gail.
So what's going on with our hormones and how does it impact our minds?
Hormones are these messengers that's throughout our whole entire body. It's not just isolated down here. What it does is that it actually influences on our brain function.
So what are we missing? Like as women, as we get older, everybody out there knows if you've hit a certain age, our hormones start going bonkers, even in earlier ages as well.
Exactly. And hormones, like I said, it influences everything, every single cells in our body. So as we start to age, our hormone starts to decline naturally. And certain patients and certain clients, what happens is that when their hormones gets depleted, it throws out their serotonin. And one of the hormones that's not being addressed is progesterone.
Okay, so how do we know if we're progesterone deficient, or is that even a thing?
Yes, so what we can do is that, of course, we can measure through saliva or we can measure through blood work. And signs and symptoms of low progesterone can be anxiety. Another red flag is that they're unable to get into that deep, deep sleep.
Yeah, and that is a problem for a lot of women, and I bet they don't know that. And then that, in turn, impacts our memory.
Yes, and then when we talk about postpartum depression, so while the female is pregnant, what happens is that progesterone is nice and high, and after they give birth, the hormone starts to decline. So what happens? They get a little depressed, and here's some Prozac for you.
And that's not what women need.
No, that's not the root cause. Sometimes, I'm not against medication, but sometimes they're there for a reason. But what we want to do is that we have to address the root cause and support the body, and then slowly wean them off of what they, is taking.
Right. Yeah. And okay, so and the next thing I wanted to talk about too is the link between our hormones and dementia, and women are far more likely to develop dementia over the years.
Yes, so that leads to estrogen. Estrogen is so important when it comes to brain health because as we start aging, we no longer have a cycle, especially with women, so our estrogen starts to decline. When the estrogen declines, the foggy memory, the mood swing, the irritability, dryness, dry everywhere, and then it affects our brain function.
Now, is there a risk to not addressing these issues and letting them just run rampant?
Absolutely, and I always believe in a check and balance system. I always believe that let's be proactive with our own health care so we can prevent all these age-related disease from coming, affecting us as we age.
Now, you mentioned pregnant women, and I want to rewind to that just a bit because it sounds to me like keeping an eye on our hormones is something that we should probably do through every phase of life.
Yes, every phase of life, because hormone changes all the time. From teenage years to our 20s to our 30s, 40s, and 50s. Teenage years, we gotta monitor that thyroid. As we go into our 20s and our 30s, take a look at your progesterone because that's the next hormone to go. Then your testosterone, then your estrogen.
I'm glad you mentioned the thyroid too because I have major struggles with that and that also impacts the mind.
Yes, the thyroid is huge. That's our metabolic machine and that allows us to actually function and it allows to move our bowel movements for us because we talk about leaky gut, how our gut affects our brain function.
Very, very interesting. Well, Dr. Cathleen, thank you so much for joining us on Bloom. We always love seeing you.
And thank you so much for having me here.